Hi, nice to see you again. In the last few lectures, we discussed some hot topics considering training methodology in general with soccer players, both females and males. And we are going to continue with this kind of lecture. I think the last lecture was about weekly cycle, weekly loading. And today we are going to discuss one really hot topic. We will discuss a little bit in more details about the cool down procedure after game or practice. So let's start with a lecture. When we are thinking about modern day technology, one can say that in the previous 20 to 30 years we have brilliant research conducted based on new training modalities that can effectively and efficiently develop various areas of physical attributes of soccer players. And we know a lot more than we did 20 or 30 years ago. For example, high-intensity interval training is now a common practice in everyday soccer training sessions. And we know about this mainly because of the excellent works by Boucher and Larsen. We now know pretty much how to overload plyometrically soccer players because of fabulous articles considering French contrast and generally post-activation potentiation. Also, beautiful articles presented by Bishop and Associates in the late 90s, close to the end of 2000, revealed repeated spiritability as one very efficient training method to increase more specific stamina and endurance. So we can say that now it is much easier for us as a strength and conditioning coaches to overload or severely fatigue our athletes in order to increase the level of adaptation and to increase the level of physical abilities. But on the other hand, when we fatigue them, as we now better know how to fatigue them, it is becoming increasingly important how to recover them appropriately. So the common question in everyday soccer practice is, your training session is excellent, you fatigued your players very good, but the main question is how many times per week or per month you can overload them. And that depends on the recovery procedures. So recovery depends on several factors. One of the main is the physical fitness level of soccer athletes. And on this slide you can see that as we reach advanced level of physical fitness, we reach the increased recovery response. So it is much easier to overload physically fit athletes 2, 3, 4 times per week, and this could not be done with the novice player. That is one factor, but also the recovery depends on other factors, and among them, the cool down strategies are of our particular interest in this lecture, and there is one of seminal articles published a couple of years ago by Bas van Horen and Associates that in details revealing aspects of cool down for soccer athletes, and we will discuss a little bit more in detail this. It is what we know about cool down. We know that generally every training session consists of some warm-up procedure, some general part or main part of the training session, and after that we have some cool down that is consisted mainly of active recovery. We'll discuss a little bit more about that. But this cool down procedures is widely assumed to promote some physiological and psychological benefits for the athletes just after the main part of the training session, and supposedly should enhance the recovery process. So should enhance recovery and should fasten make more fast the recovery process of the athletes. But when you think about it, then you try to think where does this knowledge come from? So basically, if you want some evidence-based knowledge, the real question is, what do we really know about cool down in soccer? What do we really know? What is the evidence-based knowledge? So we're going to discuss a little bit more about that. The most commonly used recovery procedure is active recovery at the end of the training session. But lately, some additional procedures such as static stretching or massage or self-massage formerly, or some breathing exercise, some yoga breathing techniques are regularly implemented in this final part of the training session. And in this article that I just mentioned a couple of slides ago, we can see that this is infographic presenting some potential benefits of this cool down procedure at the end of the training session. And as we can see in this slide, mainly this cool down is based on some low to moderate aerobic intensity activity and saturated with several secondary interventions, most likely static stretching, foam rolling, or in past few years, even some light resistance upper body training. We'll discuss it in one of the next lectures. So, what we want to discuss is the physiological. First, to discuss some physiological effects of an active cool down. And it is believed that these cool down procedures have several physiological benefits, and we will discuss most of that. The first and the far most is the removal of metabolic byproduct. 60 or 70 years ago, a group of brilliant Scandinavians scientists revealed that after a high-intensity training session, if you produce low to moderate aerobic intensity session, there is faster removal of blood lactate concentration, and that was the rationale why we should include this cool down procedure at the end of the training session. So and this is the known fact, but however, the functional benefit of faster lactate removal is debatable for two main reasons. First of all, doing nothing, or doing something, or not doing something at all at the end of the training session, whatever you do, about 2 hours after training session, blood lactate levels will decrease and reach the resting level. And it is most unlikely that athlete will do some additional training session in these 2 first hours. So maybe you recover blood lactate levels faster with active recovery, but anyway, those lactate levels will be at the resting level 2 hours after the session. And this is one point of issue. And the other issue with this blood lactate removal is that there are several articles showing that there is no clear benefit of improved athletic performance in subsequent training sessions. If you do in previous training session, if you do active cool down, which produces faster blood lactate removal. So it is true that you remove blood lactate levels faster, but what about that? It's not related to enhanced athletic performance anyhow. So generally, studies have reported a faster removal of blood lactate. So subsequent exercise performance was not improved, and this is article published in 2013. So generally, we can say that conducting active cool down because of a faster blood lactate removal is at least debatable. Considering delayed onset muscle soreness, there is a general belief that if you are doing active cool down, you will decrease the chance of getting delayed onset muscle soreness. But if we look at all the articles that were dealing with this issue, even some systematic articles were published in the last 10 to 15 years, we can say that active cool down is generally not effective, is found to be not effective for reducing delayed onset muscle soreness following exercise. So doing active cool down because of decreasing the chance of getting DOMS, delayed onset muscle soreness is also at least debatable. Also considering indirect markers of muscle damage, active pull down has been proposed to have beneficial effects on other markers of muscle damage, most of all creatine kinase level. But creatine kinase level in the blood there are conflicting study findings. First of all, creatine kinase may not accurately reflect actual muscle damage. And in summary, when we see all of the articles published about the topics, there are conflicting findings with regard to the effect of active pull down on indirect muscle markers of muscle damage, with most studies reporting no significant effect of an active cool down. So let's go on. If we consider neuromuscular function and contractile properties, we have several brilliant articles. I will mention just a couple of them. In 2004, it was told that there are no significant effects of an active cool down on the neuromuscular function generally, on the recovery procedures. Also, it was found that there are no significant effects of active cool down on biceps femoris contraction time and maximal radial displacement 24 hours after exercise. And also it was presented that there are no significant effects of an active cool down on muscle contraction time or nerve conduction, nerve reaction time 24 hours after exercise. So generally, overall, findings indicate that an active cool down does not significantly affect the recovery of neuromuscular function or contractile properties in athletes. Also, considering muscle glycogen resynthesis, there are conflicting study findings. Some of them finds even that conducting active cool down, decreasing the level of muscle glycogen resynthesis, or at least doesn't have any positive effect. So considering this aspect of recovery, also active cool down doesn't seem to have any beneficial effects. There are several articles that were dealing with recovery procedures and potential influence on immune system, with some study findings that in two first hours, it seems to be some benefits conducting active cool down, but after 2 hours, nothing significantly happens compared to passive cool down. So it's still inconclusive if this positive effect found in first 2 hours have any beneficial effect on long-term health issues of professional athletes. So on also significant topic around active cool down was discovering the relationship between cardiovascular and respiratory variables and active cool down procedures. Here we have some positive effects. When we sum up all of the studies, we can say that active cool down most likely result in a faster recovery of the cardiovascular and respiratory system after exercise. There are few brilliant studies in the 90s and later on, finding that couple of minutes of active cool down decrease the breathing frequency faster, decrease the respiration rate and heart rate faster in comparison with passive cool down. But also we don't know, there were findings that maybe this flashing moments of producing active cool down could decrease the chance of syncope and cardiovascular complications just after the training session. But we don't know exactly if it has anything to do with faster recovery and consequently increased athletic performance in subsequent training session. So there are positive effects of on cardiovascular and respiratory variables, but we don't know exactly how does it relate to enhanced performance in training sessions to come in the next days. Considering psychological effects of mood state, self-perception, and sleep, there are some published articles and the psychological effects are intimately linked to physiological effects and are also of major importance for performance. There are several published articles dealing with these connections, and most studies have not reported any significant effects of active cool down on some specific measurements of psychological recovery. However, there is one very important thing, that in most of these studies, participants, so the sample size, almost all of the participants stated that subjectively they feel positive, they feel the beneficial effects, they felt beneficial effects of active cool down procedure, and that is one very important topic, and we will discuss it a little bit later on. I don't want to get into the details, but with those psychological effects, there is also a problem of how to measure psychological effects in athletes. So those questionnaires are not with a high variability and not high validity. So it may be likely that insufficient quality of psychological tests doesn't give us the chance to really see the connection between active cool down and psychological effect. But just to underline, we'll discuss it later, almost all of the participants subjectively feel better after conducting active cool down at the end of the training session. All of the effects that we were discussing in a couple of minutes in this couple of minutes were related to acute effects of active cool down on some aspects of physiological and psychological aspects of athletes. But also there are maybe some prolonged or chronic effects, and we should discuss them in details if possible. Generally, when we are discussing about the long-term effects of an active cool down, we are discussing basically the two aspects. If active cool down has any beneficial effects of injury incidence rate, and if there is any effects of active cool down on prolonged or chronic adaptive responses or cumulative responses on athletes' body. And when we look at all of the articles, we can say that the small number of studies considering active cool down and injury incidence rate make us don't have the ability to conclusively make some statements, so the studies are inconclusive, but most likely that there are no relationship between active cool down and prolonged injury incidence rate. And we published one article especially for this. And considering long-term adaptive responses, there are some positive effects, mainly with anaerobic threshold and aerobic capacity. A little bit less information we have about anaerobic performance, but also the studies are inconclusive, but there is some evidence to suggest that active cool down has some beneficial long-term effect on adaptive responses for athletes. What can we say is that more studies are surely needed. And when we are discussing this cool down procedure, we can say that in past 10 to 20 years, there are some additional interventions that are conducting along with an active cool down, most of all stretching and foam rolling or massage or some yoga breathing drills that are connected with active cool down, and those in combination with those recovery modalities maybe have some additional effects. Considering stretching, traditionally static stretching has been used before and after training, but considering after training, from using static stretching, we can say that it seems that it doesn't reduce any muscle soreness. Maybe it can reduce muscle stiffness, but sometimes it's good for the athletes and sometimes it's not, so the beneficial effects are tricky. And it appears to contribute to reduction in post-exercise edema and improvement of subjective feeling. Again, subjective feeling, that is very, very interesting. And it doesn't seem to reduce injury risk. So static stretching has some beneficial effects, but most likely psychologically related. So stretching does not reduce the incidence of injuries in football players. We published this article some 15 years ago. Foam rolling, when we are discussing the foam rolling, we can say that nowadays foam rolling is regularly incorporated in cool down, and there are some benefits of including foam rolling as a cool down procedure because there are a few articles, but most of that proved that if you are using foam rolling after a training session, there is less muscle soreness, there is increase in the range of motion, and there are improvements in some specific athletic physical fitness attributes. For example, agility seems to be improved as a consequence of foam rolling, but unfortunately sprint on 5 meters and 20 meters seems not to be related anyhow. There are no positive effects of sprint on active pull down on sprint performance. So, well, there are inconclusive studies, but it seems that foam rolling is a good procedure. We will see in future times what the studies will tell us. So foam rolling seems to may facilitate recovery from exercise, but more research is, of course, needed. In conclusion, what can we say? Research generally does not support the application of the mentioned recovery methods for improving physiological parameters. So when we look most of the studies, there are non-significant or very, very negligible effects of most of these procedures on physiological effects on physiological parameters of athletes, soccer athletes. However, there is one very important concept. Recent studies, and one with systematic articles was published, I think, 10 years ago, said that most of these procedures increases subjective feeling of athletes. So what does it generally mean? That means that although objectively they may not recover faster conducting all of these recovery procedures at the end of the training sessions, most of the participants, day after or 2 days after, feel subjectively better. And this is a very important aspect. And, when they feel subjectively better, they will be more prone to do anything that you ask from them on the subsequent training session. And this is very important aspect of generally conductive cool down procedures and all of the modalities in the cool down procedures. So the players think that they have recovered more and subjectively experience the following training stimuli more easily. And this is maybe the main finding of our studies. And this is why there are some general recommendations about active cool down procedures. And those general recommendations are like this. First, involve dynamic activities performed at a low to moderate intensity to increase blood flow. So after the training session, at the last part of the training session, you should be involved in low to moderate aerobic activities. Involve low to moderate mechanical impact, so most likely using bikes or in swimming pools or something similar, in order to attenuate chance of getting muscle damages more pronounced. It should be short to spare muscle glycogen and not to have negative effect on muscle glycogen resynthesis. And in addition, involve any procedure that individual athletes feel that it helps them. Even if it doesn't have any objective data or objective quality of doing this. So those are general recommendations, and in future future time, I'm positive that we will see many more articles discussing this hot topic in sports science. And in a couple of years, I guess that we will have some more information. No, that will be all for today. I hope you enjoyed this lecture as much as I did. This is one of my favorite lectures, and I am willing to share some specific details of this specific topic about an active cool down in some future lectures. Thank you very much.